Hello, and welcome to the second episode of Water Solutions for a Warming World. This afternoon, our topic is water and COVID in Indian country. We have an amazing panel of experts to share their expertise with you, and we are incredibly grateful to them for sharing their time and experience. On behalf of the Arizona Institutes for Resilience, the Office of Research, Innovation, and Impact at the University of Arizona, and our co-sponsors, the Water Resources Research Center and the Udall Center for Studies in Public Policy, I'd like to thank you all for joining us this afternoon. The Arizona Institutes for Resilience is a constellation of 11 pre-existing programs and projects that represent some of the major environmental investments of the university. In collaboration with partners, we seek solutions to the major environmental challenges of our day, including climate change. Before we begin, I'd like to thank Professor Carletta Chief and our Senior Vice President for Tribal Engagement, Levi Xcara, for their help in setting up this panel. We are also grateful to Professor Toni Massaro, who graciously agreed to host this event on behalf of the Agnese Nelms Haury Program in Environmental and Social Justice. My name is Kathy Jacobs, and I'm the director of the Center for Climate Adaptation, Science, and Solutions at the University of Arizona, and we are the sponsors of this event. Before we get started, there are a few Zoom tips that we'd like to share with our viewers. First of all, please use the question and answer area at the bottom of your Zoom window to submit questions for the panelists. Those questions will not be answered until the end of this episode, but we will keep track of those questions and do our best to answer them in the future if we don't get to them today. We will choose a broad cross-section of questions from those that are submitted and those that came in to us in the original registration form. This episode is being recorded and will be posted on the Arizona Institutes for Resilience website, which can be found in the chat. We hope to learn about what works and what doesn't, so we will be sending you a follow-up survey that will come at the end. We'd be very grateful if you'd go ahead and fill that out. So I'd like to start this conversation today. We're very happy to announce that we had over 350 people registered for this event. I'm not sure exactly how many are on at the moment, but a fairly large number I noticed before I started talking. Before we begin our discussion, this series is dedicated to our former colleague, Jim Shuttleworth, a Regents professor who worked at the University of Arizona for several decades. He played a major role in understanding the role of the water cycle and how it relates to climate change. He passed away this last December. There's more about his life, family, and a video about his contributions in the link in the chat. I will now introduce today's moderator, Toni Massaro, who is a professor in the law school, a scholar and a writer, and the former dean of the university's law school. She's the director of the Agnese Nelms Haury Program in Environmental and Social Justice. She's been a tremendous advocate for tribes in her role with the Haury Program. And we're just here to say she's also an amazing person. So Toni, I'd like you to take it away, and good luck, everybody.
Thank you, Kathy. Thank you for everything you've done to push this together and for the whole series. And it's wonderful to see so many people here this afternoon into tonight. As she said, this webinar is going to explore the impact of COVID on tribes and the ways in which pre-existing water quality and access issues facing these communities made the adverse health impact of the pandemic more challenging, more powerful, more devastating. You're going to hear directly from the tribal leaders and from a panel of experts whose work before and during the pandemic has been dedicated to addressing these very complex water challenges that face these communities. Their work's not going to stop when this crisis ends. But the work isn't just theirs, it belongs to all of us. The water issues confronting these communities is a shared concern. We all have a stake. Arizona, as you know, is home to 22 federally recognized tribes. The lands, the water, air, lives, our fates intersect. And we have a common interest in the well-being of all in our region and in our world, and of finding new paths to assuring that all have access to a basic human right, clean water. As they say, water is life. The Haury program has made this our central mission. We're committed to promoting the water resilience goals as stated by the tribes themselves in ways that respect Native voice, Native sovereignty, and Native knowledge. Since last May, this has included the very great privilege of working with the Navajo Nation Water Access Coordination Group, also known as WRRC. You'll be hearing a little more about that tonight. It's an amazing group of tribal water experts, federal agencies, universities, and nonprofits who are charged by the Navajo leadership to design, build, and make known to off-grid families transitional water sites to bring clean water closer to the many homes that lack running water. This mission, despite the headwinds of this pandemic, was a tremendous success. And it's a model of respectful tribal engagement and collaboration. There's soon going to be a terrific video that chronicles the story that we want to share with you later, so you too can be inspired and that we all can be moved to join in an ongoing effort to bring clean water to all in ways that respect tribal sovereignty and knowledge. Now it's my great honor to begin tonight with just a short introduction to Dr. Carletta Chief. Dr. Chief is the brilliant and inspiring leader of our University of Arizona WRRC outreach team. And I say to work with Dr. Chief is to join a growing legion of people who regard her as one of the most amazing people we've ever met. Surely one of the most selfless, dedicated, and impactful outreach professors anywhere. Her research is changing the world for the better, full stop. Dr. Chief is Dene. She hails originally from Black Mesa, Arizona. She's an associate professor and extension specialist in the Department of Environmental Science here at the University of Arizona. Dr. Chief works to bring relevant water science to Native American communities in a culturally sensitive manner. And she's received more honors than I could possibly share with you tonight, but I think you'll see for yourselves why Dr. Chief is nationally acclaimed, but also admired and trusted by the communities with whom she shares her manifold talents and expertise. She embodies the very best practices and values of respectful tribal engagement. Take it away, Dr. Chief.
Thank you, Professor Massaro. Yad anasto kwa shata Toda shinigi to the treatment to hana bashichin. As a sane dashiche to ya eaten at Hachini Dashinala. Akut a sanishle. Good evening, everyone, to all my relatives and my friends. My name is Carletta Chief. I am Bitterwater born for near the water. And my grandfather on my mom's side is red running into the water, and on my dad's side is mini goats. I'm currently speaking from the University of Arizona, which sits on the homelands of the Tohono O'odham and Pasco Yaqui people. And I'm very honored to be here today to talk about water and COVID-19 in Indian country, and very honored to be joining this esteemed panel of Indigenous leaders and researchers and community advocates. The COVID-19 pandemic has generated fear and uncertainty across the world, with infections and fatalities spreading quickly. And especially on tribal lands, the COVID-19 rate was 4 times the US national average. Already, Indigenous tribal leaders, community advocates, and Indigenous researchers started to come together to address the alarming COVID-19 rates in Indian country, the lack of data, and the number of unique COVID-19 research questions. One of these researchers that I want to highlight is Dr. Tulley in Quantification. She's an Indigenous infectious disease epidemiology, a professor at Colorado School of Public Health. She began to map outbreaks in Indian country very early on. And as you can see in the Southwest, COVID-19 outbreaks were occurring on the Navajo Nation, White Mountain Apache, Hopi, among many others, including closer to the University of Arizona, the Tohono O'odham and Pasco Yaqui nations. In May of 2020, the Center for World Indigenous Studies released a COVID-19 risk assessment in Indian country report. They estimated that 319,000 community members had chronic health conditions in tribal and Alaska Native communities. Their findings found that all of Indian country is at the very highest risk of COVID-19 infections. And individuals in Indian country who were at this greatest risk of infection and death were among the 11% or higher proportion of the population who suffer from chronic diseases such as diabetes, disease, kidney disease, among many others. And they also said that Indian country can't rely on federal and state data because there's virtually no data gathering that's reliable and systematically collected. And so Indian country is now at risk of a major health disaster due to exposure and chronic health vulnerabilities. Indigenous researchers Desi Rodriguez-Lombert, Randall Aki, and Stephanie Carroll released a report early on in summer 2020. And they determined, they looked at what were the community households and community characteristics most closely associated with COVID-19 incidents on tribal lands. And through their regression analysis, they were the first to associate the lack of indoor plumbing in Native American households as likely associated with COVID-19 infection. In addition, they found that households in tribal communities speaking English only were less likely for COVID-19 infection. Another Indigenous researcher and engineering professor, Dr. Conroy Ben, had already been working with tribal communities to better understand their water quality needs, focusing on improving health through wastewater epidemiology, work that involved Indigenous data sovereignty and obtaining tribal research approvals. As the COVID-19 pandemic spread, there was an urgent need for fast, sensitive, reliable testing to track COVID-19 and also to reduce the spread. Dr. Conroy Ben joined the response through her work as a wastewater-based epidemiologist in tribal communities to track asymptomatic and symptomatic SARS-CoV-2 infected individuals. Her work in COVID-19 wastewater epidemiology is the leading edge in tribal communities. As COVID-19 continued to spread around the world, it also amplified food, energy, and water insecurities across the world, but disproportionately impacting Indigenous communities. In the United States, COVID-19 was rapid on the Navajo Nation, the largest tribe in the United States, with the lack of access to water being over 30%. And Navajo tribal leaders cited lack of healthy food and running water as reasons for this prolific transmission, which resulted in one of the highest rates in the United States. Native Americans in the United States also have the highest rates of diabetes. So comorbidities such as diabetes and cancers have been prevalent, especially on the Navajo Nation, where there are over 500 abandoned uranium mines. So there is a risk to already these existing environmental exposures from abandoned mines. In addition, arsenic is prevalent in unregulated waters, and this has been linked to diabetes. On the Navajo Nation, food, energy, and water insecurities were amplified, with the Navajo Nation only have 13 grocery stores across the Navajo Nation. The Navajo president was critical to addressing these insecurities. At the University of Arizona, the Indigenous Food, Energy, Water Sovereignty and Security Program responded by donating from the greenhouse 900 pounds of food. We also had already been working on off-grid technologies to provide clean drinking water, energy, and food growing in these greenhouse systems. So we were invited by the Navajo Nation to talk about the system as a potential solution. One system was already sitting at Jeannette College because we had been working with them for several years. Through this dialogue with the Navajo Nation, by their invitation, we brought together multiple institutions that have been working on the Navajo Nation for decades. This project funded by the Haury program in social environmental justice, to look at existing water quality data and to assist in the decision making to provide water to Navajo communities. In addition, we wanted to look at what are the resilience factors to increasing resiliency in these communities through these off-grid systems. This is funded by the Arizona Institute for Resilience. And then another opportunity to further collaborate with an Indigenous researcher, very well notably noted for data sovereignty in tribal communities, specifically to look at these risk factors to COVID-19. Preliminary data revealed that, again, lack of access to running water is a major risk factor to COVID-19. In addition, more prominently, the negative correlation of speaking only English and lower incidence of COVID-19. This is especially important in addressing public health messaging for tribal communities. It is clear that equitable and ethical partnerships are important in working with tribal communities when it comes to public health emergencies such as COVID-19. In addition, there's importance to data sovereignty and data ownership that belongs to tribal communities. It's important that tribes are part of these conversations, and it's wonderful to be part of this panel and begin to engage in this conversation. I want to acknowledge all the many partners and allies, the Indigenous tribal partners that we have on the Navajo Nation, as well as the faculty and staff involved. Ahehe, and thank you very much.
Thank you, Dr. Chief. I'm now very honored to introduce Chairwoman Gwendina Lee Gatewood. She's the chairwoman of the White Mountain Apache Tribal Council. And when she was sworn in as chairwoman in 2018, she was the first ever female elected to that position, which is the highest office of her tribe. Thank you, Chairwoman Lee Gatewood, for making time to join us for this important conversation. And we'll turn now to you to share your perspective on the impact of COVID on your community and how water relates to this impact.
Thank you. Good afternoon, everybody. You know, the White Mountain Apache people were still dealing with COVID. It never left, and it's been quite a challenge. And this is our Great Seal. And again, thank you for the introduction. Thank you for the invite. Outstanding presentation to Dr. Chief there. And if I could have the first slide, the next one. Our reservation is on the Fort Apache Indian Reservation. It consists of 1.6 million acres in East Central Arizona. It ranges in elevation from 2,600 feet in the Salt River Canyon on the southwest corner to over 11,400 feet at the top of Mount Baldy, one of our sacred peaks. It includes some of the richest wildlife habitats in the state and more than 400 miles of streams, creeks, and rivers. And the tribe has approximately 17,000 enrolled members. There are more tribal members that have children that don't meet the blood quantum requirements. We do have a larger population, but the ones that are enrolled generally amount to about 17,000. Next slide, please. COVID-19 cases on the Fort Apache Indian Reservation, like many other communities, our first infection was in April 1, 2020. and the total infections to date is 3,971. We had a prevalence of 22 to 28%. And we had to post these signs that you see here on the entryways to our reservation. And no visitors due to COVID-19 and only tribal residents. This set some challenges for our tribal members who live in the metropolitan area. Say someone from Tucson who wanted to go visit grandma, couldn't do it because we had a no visitor enforcement at that time, which added a lot more to the impending crisis that we would be facing as time goes on. Next slide, please. And this is our daily and total COVID-19 case count from April 1, 2020 to present. And as you can see, our case count is fairly high. And then the graph, our goal was to flatten the curve. And when you have a multi-generational household and different, family units, it can add to the challenges of trying to contain the virus. And, we had a lot of challenges with the outbreaks at certain points in time. And as it relates to water, I must add that during one of our times where we had to do a lockdown, a certain portion of our reservation ran out of water. We had a 14-day shelter in place. We were like 6 days away from ending our shelter in place, and we ran out of water for a certain number of communities. So that added to containing the virus, but yet knowing that our tribal members needed to get water, having this shelter in place, but yet knowing that they needed to get water, we had no choice but to lift that enforcement so that people could go and get water for their homes while we fixed the water line to help in that dire situation. Next slide, please. We do have a lack of drinking water. The virus on the reservation is likely attributed to several factors, including limited access to water. For decades, we have experienced outages, declining water quality, and a diminishing water source. Without a storage reservoir, there's not enough drinking water, and the problem will only get worse as the population grows. Our water lines are antiquated. They're from the early 1980s. And so we have wells, and when certain areas can't have enough water brought to them, it adds to the wells running out. And then you send out a notice to your tribal members, please conserve water. And once we put that notice out of please conserve water, that sends more of a signal to, all right, fill up your tubs, get your jugs, fill up your troughs, and then your water, the wells are going down, and then the motor, that needs water to run, then quits running, and then now you have a bigger problem. So that's been a challenge for us. Normally happens during the summertime. Next slide, please. Like I said, during certain times of the year, different areas of the reservation, there's no water for showers, hand washing, basic drinking water needs. It creates a serious health and safety hazard, especially for our elders. As shown, on the next slide, there's a direct relationship between potable water and deaths in Indian country. And although there's been some progress delivering potable water to the homes, the data clearly shows that those homes without potable water continue to suffer from infectious diseases. And especially during COVID-19, some of our homes do not have water sources, meaning they don't have a faucet in their home and they need water. There's a community on our reservation called Carrizo. There's about 75 homes there, and they have to have their water brought in on a weekly basis. And the water that's there has so much manganese and other elements that makes the water almost black, gray. And that's something that we're still dealing with. And it becomes an issue when things like this happen with diseases, and your number one priority is to wash hands. That's been the most heavily sent message to our people. Make sure you wash your hands. And if they don't have water, it adds to the problem of, well, how am I supposed to wash my hands, especially if the creeks are running a little low? You know, it just adds to the problem. Next slide, please. Here's a relation between drinking water and deaths in Indian country. As you can see, between 1960 and 1970, we have high rates of gastrointestinal diseases and post-neonatal mortality rates per 1,000 births. And as you increase your potable water, those other rates go down. And that is a graph that's pretty self-telling in terms of how drinking water and deaths relate to each other. Next slide, please. And the tribe's rural water system. To address this chronic water supply challenge, Congress and White Mountain Apache tribe have the Water Rights Quantification Act, which was passed in 2010. And that was quite a enormous victory per se for the tribe. And it's going to provide safe, secure, dependable, good quality water supply for our communities and tribal members, but it's years away from completion. And unfortunately, this pandemic has slowed the work of the rural water system, but the tribe, you know, we're moving forward expeditiously as possible. Took a lot of negotiations and working through the process, and depending on our negotiation team. And, you know, it takes a lot to put this whole rural water system together. Just to give you an idea, my former boss, who I was an executive assistant to, Chairman Ronnie Lupi, bless his heart, he has departed this world. He was chairman for over 52 years and tribal council the other times that he wasn't a chairman. And he started the rural water system process many years ago. We're going about 40 years now trying to get our rural water system to its fruition. So we're still working hard on that, and our people, you know, every year we're really hopeful that will progress even more. Next slide, please. And these challenges, you know, it has really shined a light on the lack of safe and reliable water for much of Indian country. The tribe has worked with our congressional delegation along with other tribes to secure funding in COVID-19 legislation for drinking water infrastructure for Indian country. For example, down there on the bottom, it says earlier this year, Congress passed the American Rescue Plan Act, which authorized, among other things, $20 billion in direct funding for the Department of Treasury to make payments to tribal governments, which can be used for water infrastructure. So that's going to be very, very important. And $600 million for Indian Health Service for health facility construction and sanitation programs. And given that there's over 500 recognized Indian tribes in the United States, when you start piecing that out, you know, that was a problem in the prior CARES Act distribution. Some tribes didn't get any funding, and you're probably wondering why. They went off of NAHASDA figures, which is dealing with housing, federal housing dollars that go to the tribes. Some tribes don't have that opportunity, so automatically they were not a part of the distribution factor. So that creates a little bit of a problem there. Next slide, please. And there's still more work to be done for the White Mountain Apache tribe and the rest of Indian country. For example, Indian Health Service has indicated that as of 2019, there are over 1,500 water, sewer, and solid waste sanitation projects on IHS's deficiency list at a combined cost of approximately $2.5 billion. And this funding only addresses sanitation facilities and does not include the cost of water infrastructure necessary to deliver water to tribes. That cost is undoubtedly much higher. It's taken a national pandemic to expose the drinking water crisis in Indian country, but we will keep fighting to secure a clean and reliable water supply for our members. So it has been a challenge, especially leading the tribe through this process, and gaining the trust of the elders and the members to the doctors, and working together to move forward through this pandemic. But thank you very much.
Thank you so much, Chairwoman. Next, I will turn to Jonathan Nez, who's the president of the Navajo Nation. And I want to take this moment, President Nez, to thank you for your leadership and for allowing Arizona to work with the WACG Water Access Coordination Group. In addition to shouldering the duties of president during the crisis, President Nez is currently a doctoral student in political science. And his work centers on issues of local empowerment and mobilizing local communities of the Navajo Nation and enhancing the local sovereignty of the chapter areas. Thank you so much, President Nez, for being here this afternoon, or this evening for you, and sharing your perspective of the impact of COVID on your communities and the intersection with water. Take it away, sir.
Well, I just want to say thank you, Toni and Kathy, Levi and Carletta, and many others for the invitation and having this session, and a very important session. We are in the process here at the Navajo Nation we're going to be welcoming the First Lady of the United States of America, Dr. Jill Biden, tomorrow and Friday. So there might be some background noise, maybe people on the roof, Secret Service and all. But I just want to thank everyone for bringing attention to the needs of Indian country. Events like this bring awareness to what's happening throughout the country, our healthcare, our infrastructure needs. And if you're familiar with the Navajo Nation, I think many of you all are. The Navajo Nation's in 3 states, New Mexico, Arizona, and Utah, 27,000 square miles of land, 18 million acres, and about close to 400,000 enrolled members, and just recently received an update. And there are 6 larger communities here on the Navajo Nation growth areas. Majority of Navajo people do live in the rural parts of the Navajo Nation, where water access and water infrastructure are very challenging. And just as was mentioned by Chairwoman Gatewood, there are a lot of needs in tribal communities. Here on the Navajo Nation, 30 to 40% of our Navajo households lack access to drinking water and water utilities. This includes an estimated 9,600 homes, or more than 37,000 tribal citizens with no water piped into their homes. Of course, the Indian Health Service and 638 healthcare facilities in Navajo communities offer extensive healthcare services, but also lack certain specialized medical care, and is also underfunded by nearly half of the need that is present. And this pandemic highlighted that. And I think it highlighted the need to improve the healthcare system all across the country, but more so in the Indian country. COVID-19 and the need for running water. And COVID-19 has really hit Navajo hard. I'm sure you at least seen maybe a segment or two about the Navajo Nation being hit very hard. At the beginning of the pandemic, the Navajo Nation had the highest rate of infection in the United States, outpacing major cities in America, including New York City and many countries in the world. And I think a couple months ago, Phoenix took the lead at one point, having the highest per capita rates in the world, to my understanding. So, many communities have gotten hit hard in many places, especially in communities of color. But the Navajo Nation healthcare system was immediately overwhelmed at the time, necessitating the need for healthcare support from FEMA, DOD, the veterans, National Guard, nonprofit, and kind folks all across the country, even down in Phoenix, Los Angeles, helping with PPEs and food and hygiene kits and things like that. And we appreciate the support that we received from our friends of the Navajo Nation, even though the tribes had to file a lawsuit just to get our fair or our share of CARES Act fund. And sometimes that's what you need to do in order for the federal government to recognize the inherent sovereignty of indigenous communities. But some of that relief came a little late, but we did utilize the CARES Act funding for the needs of our Navajo people. And now we're working with our healthcare professionals that are reminding our Navajo citizens to mask up, also social distance, wash hands, and stay at home as much as you can. Our vaccination rate has been on a good note lately because I think the Navajo Nation has brought confidence in taking the vaccine. Over 246,000 doses have come to the Navajo Nation, and 214,000 plus have gone into the arms of our Navajo citizens. That's 87%. And 93,813 to be exact of our Navajo people have been fully vaccinated. That's over 50% of our Navajo people. And we've been seeing some very low numbers lately. Just yesterday, we were 10 days in a row of no deaths, fluctuation of COVID positive cases each day. And we owe it to the Navajo people. They have been honoring and respecting authority, not making these very stringent protocols political. It's about the greater good, helping each other out by wearing masks. It's not about restricting freedoms, also staying home. And I think because of that, we have seen some very low numbers here on the Navajo Nation. And a lot of partners that helped us, we acknowledge their support, including, University of Arizona and many of the folks that are on this WebEx and call, and over 350 participants who are signed on. Many of you, helped out, maybe made some homemade masks, sent it to the Navajo Nation. We appreciate your support when we were waiting for the federal government to issue the relief needed to tribal communities. And that's just not Navajo, it's all 574 tribes throughout the country. But we managed. I think that is what I've been telling many people. It magnifies the resilience of Indian country to be able to help each other out, in friends of the indigenous communities coming out and supporting one another. So we appreciate that. The coordination among federal, tribal, and nonprofit organization was really critical to work with multiple resources. Funding mechanisms and technical engineering support was critical to efficient and responsible use of funds, time, and resources. One organization organized federal tribal state group, which will be discussed in depth, is the Water Access Coordination Group, the WACG, and appreciate Dr. Crystal Tulley Cordova, one of our own. We grow our own, we send them to school, they get their education, and they come back to our nation to help our people, including Dr. Caroletta Chief and many of you that are on the call. We appreciate your support to your communities. And 60 Navajo communities and over $5.5 million were spent for water access infrastructure, public messaging, and training. With future funding from the American Rescue Plan Act, the Navajo Nation is ready to continue water infrastructure development for thousands of homes within the Navajo Nation. Total funding to address the water Navajo Nation's needs is approximated to cost several $billions. And this is one way to empower our citizens by providing infrastructure, not just water, but electricity, broadband, telecommunications, and better road infrastructures within our tribal communities. So in conclusion, the COVID-19 pandemic hit the Navajo Nation very hard, given the socioeconomic conditions within the nation, the lack of water accessibility, and disproportionately high number of Navajo people with underlying health conditions, those that are in that most vulnerable population category that make COVID-19 and its variants particularly deadly. The Navajo Nation is working hard with multiple governmental and nonprofit organizations to address the water needs of the Navajo people. And again, I want to say thank you, special thank you to all the organizations who have given to the nation, supported the nation, and empowered our citizens with resources through these trying times. Thank you so much. I'll end my presentation. God bless.
Thank you very much, President Nez. And it's a privilege to work with the tribal communities in service of your goals. Let me now pivot to introduce our other distinguished panelists and ask them to respond to the remarks of Dr. Chief, of Chairwoman Lee Gatewood, and President Nez. First, and if the panelists would light up your screens so folks can see you, is Dr. Otaki Conroy Ben. Dr. Conroy Ben is of the Oglala Lakota from Pine Ridge. She's an assistant professor in the School of Sustainable Engineering and the Built Environment at the Ira A. Fulton Schools of Engineering at ASU. Her research focuses on the biological effects of polluted water. As she put it, I'm a wastewater engineer, and I study it to help detect disease, including COVID. You'll also meet Beatrice Norton, who is on the board. She's the board chair of the Hopi village of Oriafni. The Hopi village, hers, is one of the oldest known continuously occupied villages in the United States. Her community remains committed to traditional lifeways, but recently it's invested in solar energy and more local water supplies, as she'll explain. Chairperson Norton says she seeks to be a spokesperson for the elders to keep their culture alive in her village. And then will be Dr. Crystal Tulley Cordova. She's Dene, a principal hydrologist in the Navajo Nation Department of Water Resources, Water Management Branch. She's worked collaboratively with Navajo Nation partners on water-related research since 2013. She's a key member of the Water Access Coordination Group. She's an amazing hydrologist. She's absolutely committed to addressing the water quality and the access needs of the Navajo Nation. And she's also a patient and great mentor. Particularly, we want to thank her from the University of Arizona Haury program team. She's taught us an enormous amount, and it's been fun and a privilege to work with her. So all of the panelists now and our introductory personnel are going to be on the camera. I'm going to open the floor. First, I would like sort of opening statements from each of the three remaining folks. And then if you might, interact in more conversational style, and then we'll see where we're at. If we can get to a couple of questions at the end, but we really want to hear your message. Dr. Conroy Ben, why don't you start us off, please?
Hello, can you hear me?
Mm-hmm. You sound great.
Great. So I wanted to share a little bit of what I'm doing related to water and COVID in Indian country. Okay. So in my work, we are using wastewater-based epidemiology where we're collecting wastewater from a large community, from a large sewer shed, to look at health metrics, including substance abuse, diet, indicators of diabetes, and more recently, infectious disease. And this is in response to the COVID pandemic. So as long as we have, a community inputting into a sewer shed, a main sewer line, we have developed the analytical techniques to measure drug metabolites, contaminants that you have been exposed to, as well as viral particles shed in your waste products. And if we know the population and the sewer flow rate, before that water sample hits your wastewater treatment facility, we will collect it and analyze for the different chemicals or microbes. So we want to do this in Indian country. The map on the right shows the wastewater facilities registered through the Environmental Protection Agency. So these are facilities that actively discharge into the environment. And so they are required to have something called an NPDES permit. So to implement wastewater-based epidemiology, we need to know more about tribal wastewater infrastructure. But there are many tribal facilities, terminal lagoons, perhaps facilities that don't discharge, that are not in these databases. So we want to know more about these tribal communities to determine if we can implement this type of research with their tribe. This is wastewater-based epidemiology in practice. We first meet with utility directors, health directors, we get tribal approval, we then seek funding, and all of our work goes through the ASU Tribal Research Review Board. Once we have approval, we'll coordinate with the tribal utility, analyze samples, and then return results to the tribe. And so what we're doing related to the pandemic is we're quantifying the viral particles coming through a sewer shed through qPCR, as well as protein analysis. And then we're also going to sequence the variants found in wastewater. And this method has been used to inform an indigenous community in the town of Guadalupe, located between Tempe and Phoenix. When wastewater levels were decreasing in the surrounding areas in response to the lockdown last year, levels in this community remained high. And so my colleagues here at ASU met with the town leadership to inform them of what was going on. And in response, the town leadership implemented stricter measures. And this is my team. This is a large collaborative effort. I'm working with GIS specialists, people who regularly engage with tribal communities, risk specialists, as well as the Intertribal Council of Arizona. And so through this work, we hope to bring this method to tribes to look at not only the COVID pandemic, but future pandemics, other health disparities such as substance abuse. And with that, I'd like to conclude my remarks. And I'd like to say Pilamaya to the University of Arizona, to Carletta, and to the organizers for inviting me to share my work and my perspective.
Many, many thanks for that. Chairperson Norton.
Okay. Good afternoon. I am Beatrice Norton from the village of Oriafni. As mentioned, it is one of the oldest inhabited villages or town in the United States. And so for that reason, and a lot of the cultural reasons based on our migration stories and our traditional teachings, the village of Oriafni has chosen for many years not to participate in the tribal government by receiving funds from the tribe. We also presently, and up to today, we presently do not have water and sanitation within our village. And in listening to the speakers ahead of us, you know, we did find when COVID hit, we found it very challenging because we don't have running water. And as many of the communities on Hopi, we also shut our villages to visitors. And so we quickly were thrust into having to mitigate and to address some of the needs of our people. And so what happened was, well, we have a watering point, which is about 5 to 6 miles away from our village. And people go and bring haul water to their homes, you know, through buckets or through water containers of some sort. And so what happened with us was we had to find a way that could make water more accessible to our community. And luckily, through the CARES Act and with the Indian Health Service CARES funding as well, the village invested in 2 what they call water buffaloes. They're huge water tanks and trailers and vehicles to make water more accessible. So we would haul the water into the village for members to get their water. And we had 2, what do you call them? The, I can't think, wagons, those big wagons, you know, and water buckets so that they can take water to their homes. We organized about approximately 3 years ago, and that was very historical for us, you know, to establish a board. But one of our primary goals was to take our funds out of the tribe, invest it, and the other one was about the water, to work on our water system and water well. So through the CARES Act, then we were able to put in an application, and we had our water well drilled. We were already in the process beforehand, before the COVID-19 came around. And so we already had sites identified, you know, for water. But in some ways, you know, I know, and we know that water is very, very sacred. Water is life. And so, you know, with the village here, they are very, very conservative, you know, not having water taught us how to be conservative, but also in some ways it conflicts with our who we are as Hopi, because with our annual ceremonial calendar and all our ceremonies and events that we do was always for the rain. And that's how, you know, our villages survived many, many years. Here in Oriafni, you have water cisterns throughout the entire area. I can't say how many they are, but that was what the people depended on, was the rain, you know, to fill up these cisterns naturally, or even, you know, they were built by the men. And that's how they would get their water. But we know that slowly, you know, we are going into this era of where we know that water is going to become scarce. Knowing that and drilling our water, we have also, and it's based, it's again the leadership, our traditional leadership, who still hold on tightly to that teaching. And so we will have running water and sanitation in a certain area, but the village will remain as is. But we are working towards, figuring out a way that we can still be able to provide water to our people. And luckily, our COVID number here in the village was only 27, but that's 27, that's a lot to our small village. And so we are currently now with the new funding, we're hoping that, that we can be able to expand. The water is drilled, it's running, but now the next step is for the water lines to go in, building a lagoon. And what we've also done is we purchased a portable shower trailer and a laundry trailer, which will be situated in the village where people can do their laundry and where they can do, where they can take showers. So that's one way. Thanks to a lot of the nonprofit organizations, they were able to assist us with water washing stations. Primarily that is Red Feather. We collaborated with them and they offered to provide us these hand washing water stations that are made out of the plastic trash cans. Pretty nice. It has a little foot lever and there's two trash cans side by side with a lot of piping, and then you just press on the little foot pedal and the water comes out and you're able to wash your hands. And so most of the villagers got that little gadget, and it has made a big difference, during this pandemic, where we were able to keep our, washing our hands. And when winter came, then a lot of them, put that into the inside of their home where they were still able to be able to manage, the little watering, the hand washing station. And so I know that, efforts, there are a lot of efforts going on, and we are very much interested in, projects as far as, how we can begin to assist our members in the village with water usage and having safe water. I know that in the other villages, there is cases of arsenic in their water. And water has become very important. And so as the chairperson of this board, I think we never anticipated to be thrust into something like this, but we really moved forward with the team that we have on our board to get things situated. We also have a solar project that we installed into the main village because we don't have power, electricity too as well. And we felt that that was the best fit for that village because of the stance that our leadership had about not putting anything into the main village, just because of our spiritual belief of what our village stands for. And so thanks to Gilbert and Sons Engineering Electrical Company, they they were the ones that put in the solar power that they originally are doing work in their own Navajo Nation reservation, putting these type of solar power, which can operate a full fledged refrigerator and lights, up to 5 lights and power. Okay, So I will end it there. And thank you for your invite.
Thank you so much. And it's especially important and critical to hear how your community has committed to your own history and creation story in the context of these dramatic challenges. And so thank you for
Yes.
sharing that. So it's very impressive.
Mhm.
Dr. Tulley Cordova, you're up next.
Ja, het is Crystal Tulley Cordova en de schet voor het eten in de slecht gaat net als niet was chin hash on his edische cheto higlini edishanelle. I am of the Bitterwater clan, born for the Tango people clan. My maternal grandfather's clan is a yucca fruit strung on a line, and my paternal grandfather's clan is the water that flows together. And I share that because it was my destiny within my lineage to be able to go into water. And I appreciate the opportunity today to be able to talk about how we are working to be able to, how pre-pandemic we have been working to be able to address water access challenges within the Navajo Nation, while also during the pandemic have been added challenges associated with providing access to water. But one of the things I wanted to be able to provide was a background from people in the audience who may not be aware of these wicked water problems, if you understand it as such, meaning that the Navajo Nation is over 27,000 square miles. It spans across 3 states, and it straddles both the upper and the lower Colorado River Basin. We have a sparse rural population and living, and like many cities throughout the country, we don't have a lot of subdivisions and cul-de-sacs with largely populated areas. But in addition to that, Dr. Chief also mentioned the abandoned uranium mine legacy that we have within the Navajo Nation. There has been work that has evaluated by Jani Ingram et al. At Northern Arizona University that has evaluated water quality of unregulated waters. And there have been associations with some water systems within the public water systems in the Navajo Nation that have been shut down because of high uranium as well as arsenic that exceed the maximum contaminant levels of what the EPA deems the maximum contaminant levels for uranium and arsenic. But in addition to that, because of the geology, we also have brackish water in the area with over 25,000 milligrams per liter in some areas with variability. If you were to look at a map of Arizona or a map of the Four Corners region, the southwestern portion of the Navajo Nation has this challenge associated with it. But when we really look at the barriers of water access challenges throughout Indian country, they boil down to a few things. The need for water infrastructure, capital development, while also the aging infrastructure that we have. We have inadequate water quality, as Beatrice had discussed, and we also have deteriorating infrastructure, so current infrastructure that is deteriorating, as well as a need for operation, maintenance, and replacement of these systems. Many times when there's development that occurs, we have the funding for the capital development, but there tends to be a need for the sustainability of any type of water project or energy project or broadband or telecommunications, the need for the sustainability of that through operation, maintenance, and replacement. But it's important to have an understanding that pre-pandemic, we were in the business of water development, and that development, we have a main larger community, and then we have 3 satellite communities in the Navajo Nation, as well as a community just west of Blanding, Utah, called Westwater on sea land there. And it's important to think about how these different land statuses also impact water quality in the area. And with that understanding, we have a technical advisory group in which across this, 27,000 square miles, we have to be able to work together collaboratively on these efforts. And President Nez had the opportunity to be able to discuss the Water Access Coordination Group on the Navajo Nation. We have such to be able to address water access challenges during the pandemic. And we work with a bunch of different partners that vary from federal, state, nonprofits, other non-governmental organizations, as well as academic institutions. And it's been a great opportunity to be able to do that. And associated with that, we've had the opportunity to be able to inform the community of the transitional water points that had been constructed using CARES Act funding that was allocated to be able to address, to save time, to save money for those water haulers that live throughout the Navajo Nation to have water closer to them, while also distributing 37,000 water storage containers and 3.5 million doses of water disinfection tablets. And because of our large, not population, but we also have a large range in age across our population, how people get information. So when you think about media outreach, it can't just be, on the radio in English. We have to have bilingual ads on 4 different radio stations that span across the Navajo Nation, KTNN, KNDN, KGAK, as well as CAF, so that we can reach those audience members who get their information about their community through the radio, while also we work with the Navajo Times to be able to show ads in there to show the resources that are available to them. We also have some Facebook ads. Some of you might have seen it under Dig Deep. If you have the opportunity, look up NavajoSafeWater.org to learn more about this program. But we also have put out governmental announcements through our own tribal government. But it's been an opportunity, while also partnering with nonprofits like Dig Deep. We have the opportunity to collaborate with them to reach those individuals, the high percentage of Navajo residents who don't have pipe water within their homes. But then Dr. Chief had shown a diagram as well of the work that we're doing with Indigenous youth to be able to look at that food, energy, water nexus and work collaboratively together to bring decentralized systems that can be able to address the brackish water challenges that we have through desalination efforts. We also have, had the opportunity to work with organizations like Johns Hopkins University to be able to gain a better understanding of, what is really needed. When you don't have running water, hand washing stations have been distributed to be able to assist with that, especially when we have residents that live in multi-generational households. We're working on a number of different issues. Dr. Chief also showed some of the water quality work. Not a lot has been done to be able to do research efforts, because a lot of our priority is to get water developed so that people can have it for human consumption, while we also have our livestock in mind, because we have a large number of people who haul water from livestock wells, not only for their livestock, but also for agricultural purposes. And so we have that's our priority, and research through our partnerships with academic institutions allows us to be able to do more together. We have limited funding within the Navajo Nation. We also have limited capacity, and by partnering with different entities, we have the opportunity to be able to do more together. Thank you.
Thank you. This has been an amazingly rich discussion. Let me just reflect a few things. And actually, we've been receiving a lot of questions, and these taken together, the panelists and the tribal leaders have answered the questions. I would reflect that what we've heard is a rich discussion of problem identification, a diagnostic from the communities themselves about the challenges that they face, but also what the solutions are, and the pieces of what the solution would look like. And honoring that and working from that is important, because you see from the remarks today also their success stories. And the success stories have a common element. They begin with the tribe's own values and the tribe's own goals. And then the partnerships are genuine partnerships, as I said up top, in terms of how the outreach needs to happen from the University of Arizona and other educational institutions, but more generally, with genuine, respectful engagement. Going forward, I would say the other thing we've heard about are just incredible stories of resilience and partnership. And that's going to be essential, as you said, or as the chairwoman said, not just now, but in the future. Rather than in the time that we have left, going through some of the more granular questions that have been raised. As I say, I think they've been responded to, but we're going to capture them. And it may be that what is called for is a follow-up session in which we take that next step together. But for now, I would like to return to the panel to ask this question. If you could say to the hundreds of people who've tuned in today and many more who will be watching this webinar, the most important thing that I hope that you will take from my remarks today, what would that be? And let's go back in the order in which we began. Chairwoman, if you would lead off, and then President Nez, and then hear from others. You know, what is the main message that you want us to hear and to heed?
Well, you know, our White Mountain Apache people, we're still here. We've always been here. And you take the sacredness of water and its elements, and we're one with the land. And if we can take care of our land, it will help take care of us. And that's a form of teachings that we have been taught. And water is very sacred. It gives life to everything. When you think about it, everything has water with it. And water for our human body has everything that's needed to help cure us, heal us, and help us. The same with the animals that we live with and all of nature. And the one takeaway that I want you to really concentrate on is that even though we live in the greatest country, you know, and this is our homeland, today we still have antiquated sources of water out there, not just for the White Mountain Apache people, but for a wide array of indigenous people out there. And that is something that we need to have consultation with. We need to have our voice at the table. And, you know, we're in 2021 now, and we still have people hauling water, and it shouldn't be that way. And as indigenous people, I would like to see each one of us as the rivers of water coming together to join to create an amazing force that delivers that message so that we get our water to our people, because we're people too, and we're a part of this entire universe that we're in sync with. And I know that when that day happens, you know, all the stars and everything else will line up, and everything will be in unity and in beauty and in one. And we will have returned to our sacredness of water and our ability to live with one another in harmony. And I know we can do it with the Creator's help, and we all come together and work towards that goal, because we're resilient. We've been here since time immemorial. So has water. And water is sacred, people are sacred, Mother Earth is sacred. Those are things that you can't ever replace, but we continue to move forward with that. Thank you.
Thank you. All panelists, please turn on your video, and now I'll turn to President Nez. That was beautifully put, Chairwoman.
Thank you, Toni, again, and the panelists, esteemed panelists. It's an honor to be part of this discussion with each and every one of you and the folks putting on this this session. I guess one thing that I would ask people something to leave this session with is to take a glimpse through our lens as Indigenous people, right? Priorities are a little different for Indigenous people. You know, for instance, when we're talking about water rights, everyone thinks, you know, those that are on and trying to answer the question about how much water goes where and who gets how much. And a lot of the times it's about water, drinking water. Tribal nations also are advocating that it's not just about drinking water, it's also about livestock. It's also about farming, you know. And those of us, and believe it or not, you know, I'm the Navajo Nation president. Back home, I have no running water where I come from. My mom and dad still haul water. And so those that live out in the rural areas that haul water, our world view is this, that when we bring the water back home, first priority is to give to our livestock because our animals sustain life. And then the next is if we have farms, we give it to our farm, a lot of dry farming. And the third will be, yes, drinking water. And so at that time, whatever's left over goes to personal hygiene. And it's no wonder why COVID-19 has hit hard in Indian country and here on the Navajo Nation, because that is our priority when we get water for our homes. That's the lens that we look through as Indigenous people. And I wanted to share that with everyone because it's a different priority for those that are looking outside into tribal communities. And the quantification of water when it comes to water rights also should include livestock and farming. And so if we're wanting our share of water, especially when we're talking about the allocation, those should be factors in the fair share of water from these tributaries, or the, if you want to call it, Colorado River, Little Colorado River water. And so that I wanted to share with everyone. At the same time, you know, we are wanting to get water to our Navajo citizens. Some of us, that's how we grew up, hauling water and taking care of our livestock. I know when we were told when I was growing up, you don't eat, you don't drink until you give food and water to your animals. And we would get up early in the morning to go do that before we even eat. See, some of those resilient teaching is still here with us and should also be handed down from one generation to the next. So thank you so much.
Very powerful and meaningful to all of us. The other panelists, please, Dr. Chief, you want to begin with what major takeaway you would like people to draw?
Yes, thank you, Professor Massaro. I think one of the main takeaways from this is the importance of understanding the unique impacts to tribal communities where their water uses and water needs are very different from the greater US population, and that engaging with tribal communities requires extensive approval processes, which Dr. Otake Conroy Ben mentioned. And so with that, it's very important to have partnerships with tribal communities that are ethical and transparent. And that happens way before any major crisis occurs, where you're already working with tribal communities, developing and nurturing those partnerships so that you're ready to assist when the time is is needed to assist. So I think also that tribal leaders and Indigenous researchers and scientists and students are in a unique place to advocate and to work together because they know their communities the best. And so I think that elevating the voices is really important, not only locally, but nationally. And like Chairwoman Gatewood Lee stated, you know, this is an ongoing problem that has been present for decades, and that only through this pandemic it has been highlighted at the national level. But I think that provides an opportune time, but also that's very unfortunate that a pandemic had to occur for the water needs of Indian country to be addressed. So I would summarize that as the key points. Thank you.
Thank you, Dr. Chief. Dr. Conroy Ben, what would you like us to carry from today?
Yeah, so I just want to say that I am honored and empowered to work with our many tribal partners. And it's, I learned so much from the panelists today. And personally, as an academic researcher, you know, I do this out of respect, you know, to my fellow tribal members and to those in your tribal communities. I would also like to express that it's great to see this type of panel that is, you know, made up of Native researchers, community members, leaders, people who are advocating for our community and for our needs. And so I just want to say that I learned quite a bit from, you know, from the Pine Ridge Reservation, but just living down here in the Southwest, how different things are from tribe to tribe, and that, you know, it's important to be engaged and to listen and to, you know, be respectful. Thank you.
Many thanks. Chairperson Norton, your closing remarks? You're on mute. You're on mute, Chairperson Norton.
Okay,
Perfect. Thank you.
sorry about that.
No problem.
But again, thank you for the invite. And I also want to thank all of the panelists who are on, you know, this call today. I know water is very important. It is very sacred. But I come from another viewpoint, you know, being a community member with a lot of traditional beliefs and values that are still intact within not only my village, but I think within the Hopi tribe. And it becomes a challenge as, you know, as we begin to move forward and to make progress within our communities because of who we are. And primarily I'm talking about Hopi. Because if you have an understanding of our annual ceremonial calendar, that's what it's all about. It's about our spirit. It's about our faith, you know, and our prayers that are sent to the what we call the gods, you know, the cloud people for their help in providing us with water and rain, not only for our use, but for our crops and everything that we need it for. And so it's very difficult. You know, we walk a fine line as we do certain things because of our faith. You know, like some of the people in my village, they're saying, well, and even though they are living on the outskirts of the village, they've already, you know, indicated that I don't think I'm going to get the running water in my house yet, because what if we do and we make the cloud people mad that things are going to be very easy for you just to turn on, a faucet to get your water. Because Hopi has relied on and has been very resilient because of the way that we have lived. It makes us very independent. It teaches us to be very conservative. It teaches us to take care of the land and not take, so much. And I think, today's society, when you look at it and when you go into the cities where water is just abundantly flowing, like, the fountains and watering the grass and things like that, if you took a traditional, an elder to that Phoenix, to a city like Phoenix and see that happening, they'll nod their heads and say, oh, these people just wasting water. And we have to go so many miles to get it, to be conservative. And so, all of these traditional teachings sometimes put us on this fine line, and it sort of conflicts with what we believe.
Thank you.
But I know that this is the future, okay?
Yeah,
Thank
thank
you.
you. I love the line, don't take so much. And we'll,
Yes.
Crystal, if you'll take us home here and offer closing remarks, I would be very grateful, as always, to you.
Thank you. Indigenous people have been here since time immemorial, and it's important to think about the resiliency that our ancestors have given to us. As Navajo people, we are the corn pollen prayers of yesterday, and our ancestors and us now have the opportunities and tools to be able to adapt with our environment. We take the best of our strengths to be able to move forward, and as such, this can help us address challenges such as climate change, where we can collaboratively work together as hydrologists, as biologists, as people with different strengths and different disciplines have the opportunity to do. But within the Navajo Nation, we have the opportunity to be able to collaborate with different partners. For water development, the three main partners that we have, but have grown significantly since the pandemic, are, Navajo Tribal Utility Authority, the Indian Health Service, as well as the Navajo Nation Department of Water Resources. I mentioned that we can do more together. And as Indigenous people, when people are having difficult challenges in our family or our friends and their families, what we do is we bring our strengths together. And it's important that although this pandemic has hit us very hard, that we take the good that has come out of it. The silver lining for us has been the spotlight that has been shown on the disparities as far as infrastructure, as far as healthcare. And it's important to be able to think about the perpetual federal trust responsibility to tribes, nations, and pueblos within the United States to be able to help us address this. And I'm glad that the current administration has been listening to be able to hear us at not only at the executive level with the Biden administration, but also at the legislative level, even the committee members on the Senate Committee for Indian Affairs, various senators, such as Senator Bennett from Colorado, introducing a resolution, as well as being added upon by 10 other colleagues to be able to acknowledge that there is a need for universal access for clean water in Indian country.
If you're watching and you haven't been inspired, you haven't been watching. The message has been clear, eloquent, powerful, and I am so grateful to all of you for making time. I know how busy each of you is. Maybe I don't. Maybe I can't even fathom how busy each of you is. But we thank you with our whole heart, and let's go forward together, as been said here, because this is solvable. This is solvable, but not if we're not all in it. And so I want to thank all of you. Have a safe evening. Say hi to Dr. Biden for us, President Nez. Hello. Thank you, Chairwoman. Thank you, everybody. Be careful driving home. Thank you for tuning in.